Good morning, everyone, and it is my great pleasure to open this morning's Women's Health Conference and to welcome you all here to Smock Alley Theatre here this morning. Finally, then, our last panel will take a look to the future. Where do we go next for women's healthcare in Ireland, and what are our aspirations? What do we want to see achieved for women in Ireland in terms of meeting their healthcare needs? I think you'd agree it's incredibly empowering and incredibly powerful to see so many women collectively speaking with one voice to advocate for better healthcare for women in Ireland. For so many years, we have been under-resourced and not cared for in the way we would like to be. We have to ask the question, when we look at things like menopause and menstrual health, why have we consistently taught our young girls and women that it's actually acceptable or that it's okay or normal to be in consistent pain, fatigued, distressed and under pressure? It's not normal and it's not acceptable, and there is help out there. So we have to shake off that culture of telling women that that's just your lot and you just need to get used to it. It's the wrong message to be sending to young girls and to women. And I think it is quite empowering. The topics that we're discussing here, you know, we haven't got every particular health issue for women platform today. I specifically selected some of the topics that I feel we've only really started to open up and talk about in the last number of years. And we want to have that open and honest conversation as women and be transparent about those issues that affect all of us, and to shake off those shackles of taboo and embarrassment and say these are really normal health issues and we all go through them and we go through them together. And with that in mind, I think it's powerful to say today that what we want is better healthcare for women in Ireland, and today is the start of pushing for that and talking to not just everyone here in the room, but to all of those watching remotely on our social media channels. I think we'll have a really powerful and uplifting and positive conversation today with all of our panellists and with our audience as well. And just as some housekeeping matters, we have our emergency exits indicated on the left and right. Our bathrooms are just to the back if you go out the door on my left as you go out. And if anybody would like to contribute to the debate, at the end of the panel, there will be a period of time allocated for a Q&A session. So just raise your hand, I'll have the microphone and I'll have a friend helping me as well. So we'd like to get as many members of the audience contributing and engaging in the discussion and asking questions, because we're all here to have the conversation together. So what I'll do is hand you over to our first panel and this morning's moderator, Alison O'Connor, who is very well known to all of you and probably needs no introduction, but I'll introduce her in any event. So Alison is a journalist, broadcaster and editor and author. She writes a weekly column for the Irish Examiner, and as a current affairs commentator she regularly appears on radio and television. Her most recent book, It's a Yes, co-written, and ladies really
discussing all of these topics. The title of this session, Good Menstrual Health and a Positive Menopause. And we've already had a chat there earlier before we come on, and the question was raised, well, can we raise the issue of vaginal dryness? I said, I'll be disappointed if you don't. And I was thinking, in my house, I have two daughters, so we're running, given the title, the range of from where menstruation has started and just started, and where menopause is very definitely on the horizon. And as my daughter saw me putting on a HRT patch some time back, she said, what's that? And I said, you know the way your hormones are going this way? She said, yes. Well, I said, mine are going this way. So I'm going to introduce you to my panel now, and from my chat with some of them earlier, you know, there's an awful lot to be said, and as Lisa said, there will be questions afterwards. So sitting here right beside me, I'm delighted to introduce you to Dr. Fayqa. It's good. Fayqa. Her family to be targeted when the Taliban took control of the country. Named on a kill list, they fled their home and now have refugee status in Ireland. Dr. Fayqa's wish is to contribute to the health service in her adopted homeland. Beside Fayqa there is Dr. Ciara McCarthy. Ciara is the GP clinical lead for women's health with the Irish College of General Practitioners. She is a Cork-based GP with a specialist knowledge of women's reproductive health and a member of the ICGP's Council. Ciara will lead the expansion of the ICGP training programme in women's health for Irish GPs in recognition of the demand and need for women's health services at general practice level. Ciara works in a large suburban practice in Cork. Beside Ciara is Shampa Lahiri, and having spent over 20 years living and working in Ireland, Shampa didn't even have a local GP when she was diagnosed with cancer in 2019. As a teenager, she was diagnosed with endometriosis at a time when treatment options were limited. Shampa's cancer journey had severe side effects which impacted all aspects of her life. Having navigated the Irish healthcare system for the last few years, she's keenly aware of the challenges faced by women, in particular ethnic minorities. She uses her skills to advocate for better patient outcomes, and she has joined the Irish Cancer Society's advocacy network. Shampa is actively advocating for more equitable outcomes for all patients in the Irish public health system. Besides Shampa, we have Catherine O'Keefe, who is the founder of Wellness Warrior and creator of the Menopause Success Summit. She is Ireland's first menopause coach and workplace educator. Catherine helps women achieve optimum health and well-being in perimenopause, menopause and beyond. She has worked with more than 150 companies on menopause support in the workplace, including Workday International, State Street, Department of Health, Sainsbury's and Microsoft. And last, but certainly by no means least, we have Nora Casey, who, Nora, as many of you will know, broadcaster, entrepreneur and human rights campaigner, formerly a dragon in the Dragon's Den, and recipient of numerous awards. Nora is an author, and her TEDx talks include The Cure for Grief and The Courage to Leave. Nora's digital learning platform, Planet Woman, seeks to empower women, and much of her life is devoted to mentoring SMEs and female founders globally. As well as owning Harmonia Publishing Limited, Nora odd range feel about going to their doctors and discussing the various issues.
So I think we've come a long way, but I think there's still a part of the journey that needs to be travelled. I suppose we talk about the Joe Duffy effect, and I think he opened the conversation about menopause, because for the last 20 years HRT was, I don't want to say it was a taboo topic, but it wasn't widely used, it wasn't widely prescribed because of fears that were proven to be, I suppose, exaggerated. And he has certainly, encouraged women to come in their droves to their GP to speak about menopause and to find solutions. But I think there are areas that we certainly need to improve on. I think we are.
Can I interrupt you for just 1 second? When you say come in their droves, describe to me the sort of before and after, just in terms of.
So I would say before the Joe Duffy show, I would rarely see women. Heavy menstrual bleeding, things like that, pelvic pain, that they, your GP can help that, and if the secondary care service, health service can help, and that there are services there, and we're looking to improve them. So
and tell me then, on those issues, the urinary incontinence, the vaginal dryness, do you see many women? Even though, are there a lot of women suffering from these symptoms or conditions, and do you see a lot of them?
We see them, but I don't think it's always the reason that they're coming to see us.
Right.
They may be coming with something else. So say, one of the things that we see after menopause is that there can be an increased frequency of urinary tract infections, of bladder infections, and that's associated. So when we look at those as a symptom of menopause, they're grouped with things like vaginal dryness and urinary incontinence. So it's only when I suppose someone might come to you with bladder infection, and when you inquire about any associated symptoms, they divulge them. But I think if you hadn't asked, they mightn't have volunteered them.
Yeah. And at the other end of the spectrum then, in terms of young women beginning to menstruate, and maybe it not being straightforward, perhaps having very bad pain, that there's undiagnosed endometriosis, what's the state of play at that end of things?
So the Women's Health Action Plan was launched by the Department of Health in early March, and there includes in that a plan for expanding and improving endometriosis care. So improving, I suppose, facilities for the diagnosis of endometriosis care, but also for the management of, I suppose, I don't want to say straightforward cases, because I think there's no case is completely straightforward, but that there would be services within regional health, and then also 2 specialised endometriosis care centres, one in Dublin and one in Cork, that will be able to care for patients who need the care of a multidisciplinary surgical team, so that they would have access to urology surgeons and colorectal surgeons. And up until now, those services haven't existed in a kind of a defined service, kind of amalgamated service, where there will be a referral pathway from, say, if you have a patient in Galway or in Donegal who needs to access that there will now be a kind of a defined referral pathway that they're...
And for delivery and other issues that women needs, they can't go alone to clinics. It's a terrible situation in our country.
Yes. And for you in Ireland?
Fortunately, I'm in Ireland, and I hope for future I have a chance to work.
Yes, yes.
For
improving all your experience.
Health, yeah, for women health improvement. I wish to work as a a doctor. Yeah. Okay,
thank you. Shampa, you also came to Ireland a lot longer ago than Fayqa. And you have, I suppose, looking as I read out your bio, you could talk to us on any number of of angles. So I'll let you pick up as to where, from what you've heard earlier, and how you'd like to get into your story.
I mean, many of the things that the other panellists have spoken about resonate with me. I turn 50 this year, and for 38 years of my life, I have suffered chronic and debilitating pain. And so for 38 years of my life, I feel that I have been at war with my own body. And we talk about all the external influences that bring us down and all the challenges of life and the day-to-day things that we all suffer. We all have hurdles in life, every single one of us. But some of those hurdles are higher for some of us than for others. And the chronic pain that I have experienced largely went undiagnosed, and then when it was diagnosed, I never sought follow-up treatment for it. So when I graduated from high school, I had the worst absentee record of anybody in the 100-year history of my school. Me and the guy who got expelled for drug dealing in year 11. So the way that this chronic and debilitating pain impacts on your life is multifaceted. It knocks you out of mainstream society for days at a time. And you're either going through pain, or you know that in a couple of weeks, you will again be going through the same or worse pain. And it felt never ending. As a child, when I was 15 years old, when this was first diagnosed, I asked my GP for a hysterectomy because I couldn't cope with the pain. And obviously at the time, I was subjected to a very invasive internal examination. I was given the pill, and then I was told to go off and deal with it on my own. So I never went back for treatment. I mean, being treated by a male GP and being subjected to an incredibly invasive internal examination is something that we never talk about. So we're talking about educating our young girls. These are 12-year-old, 13-year-old, 14-year-old girls who go in to see a doctor. They don't even have the emotional maturity to be able to articulate pain. And their feet are put into a set of stirrups and they're subject to an invasive internal examination. I say they, I mean we, I mean I. This is my experience. I can only talk from my own experience. And as a result of that one experience, I never went back for treatment. So for 38 years, I went through this pain, and I managed the pain on my own. And I managed it with industrial quantities of analgesics. So I just bought over-the-counter drugs, and I became quite dependent on these over-the-counter drugs. I don't mean medically dependent. I mean, I couldn't leave the house without knowing that I had these drugs in my handbag, in my back pocket of my jeans. I had them in my car, in my office. I would leave them at friends' house, because if the pain came on at any time, I needed to know that I had access to these drugs. When I moved to Ireland, these drugs weren't available here. I think by and large, Australia, where I grew up and where I was diagnosed, tends to be a little bit more advanced than Ireland when it comes to access to medication. So these drugs weren't available here. So every year when I would go home to Australia, I would buy up a year or two supply of these drugs. I put them into my hand luggage because I didn't want them getting lost in my suitcase. And then every time I came back through passport control, I was waiting to be pulled aside for drug dealing, for having period pain medication in my hand luggage. So these are the things that we as women get very good at navigating, how to manage pain without clinical assistance. But even with this pain, I have to say, hand on heart, I've had an incredibly valuable life. I mean, we as women, we are incredibly resilient. And we live and breathe and manage through life with this pain every day. And yet we are compared to men and we are told we are weak. I mean, I would like to see any man live for 38 years with chronic pain, manage his life successfully, home, life, career, and I want to see him do it in 4-inch heels.
Here, here. Nora, from your perspective on, I suppose, dealing with you have spoken, we mentioned it earlier, you're currently dealing with long COVID, which you've spoken about previously. But in terms of being an Irish woman, menopausal woman, what are your experiences of that and the general approach and how women speak about it or don't?
So I do have long COVID, and it's a different kind to the first iteration. I think my brother has long COVID from the first time. He still gets breathless and fatigued, but I had COVID in January, and it was really, really an easy COVID. I was bragging about how easy it was. I worked through most of it, but 4 weeks later, I got very sick very quickly, and my blood pressure went up to 200 over 120. I was in hospital for 2 weeks, and the upshot was inflammation in my brain, in my lungs. I'm type 1 diabetes all of a sudden, so I shake quite a lot. I get the sweats. I have neuropathic headaches, so sometimes I start to speak. I called my mother Mary the other day, and her name is Mags. But I can lose the train of thought, so if that happens, I'm sure that Alison will save me. But I have to say, I have lymph nodes that are enlarged on the back of my neck that are just about to be removed. I can talk to you about that openly. I've been in many boardrooms and on programs, and everybody feels a degree of sympathy and empathy with me. But if I mentioned in a boardroom when I was CEO any of the symptoms, they're very similar to the menopause, especially issues. I get palpitations all of a sudden, I get brain fog, I get headaches. Sometimes I feel a little bit more anxious because of it. There's no way at that time. I was running 3-4 companies. I was the only female of 46 CEOs. I reported to Paris, I lived in London. There would be no question of me saying, sorry lads, I'm having a bit of a hot flush now, if you just give me a few minutes. Nobody talked about it. And I think as women we go through journeys, and you've just spoken very eloquently about it, from periods, which happily I had a mum and older sisters to help me navigate through. I had IVF, I lost babies, had a beautiful baby, and then hit the menopause. I think that we have to remember that when women hit the menopause, sometimes it's at a critical life stage. It doesn't just happen in isolation. I'm part of a sandwich generation. I think some of you are too. So while I was going through perimenopause, my husband died after a very aggressive bout of cancer. My sister had died a few months beforehand. I suddenly was with a young child as a single mom on my own, and also with parents who were elderly and frail. And I was running 3 companies. In fact, through Dragon's Den, I had 15 investments. So I can tell you that menopausal symptoms are not aligned to superwoman status. They do everything in their power to ensure that you're diminished in every possible way, and the acceptability or otherwise within the environment you work plays a huge part in that. At this stage, I've just been on a ship where Gwyneth Paltrow does all the wellness, and of course she's spoken a little too much maybe about the menopause. Lots of celebrities have spoken about the menopause. Have you seen a single female politician? Now bear in mind that it takes almost the whole of our lives. I grew up in the Phoenix Park, 8 of us in a 3-bed house. I'm not going to do Angela's Ashes, but I went to a DESH school for socially disadvantaged people. The likelihood of somebody like me ending up running companies is minuscule. I still go back to that school. It's very tiny. And here I am about to take the hot seat running my own business as a female founder, and God or the universe gave me a different kind of hot seat and threw loads of symptoms on top of me. And that happens to every woman. If you think of Christine Lagarde, think of our 2 presidents, think of all the senior female politicians across Europe and the world, Kamala, just imagine. Do you think they don't get the menopause? Do you think they didn't have menopausal symptoms? Do they ever at any point say, sorry lads, hot sweat coming on, bit of brain fog, don't ask me that tough question just now. So long as they don't talk about it, their employees and people who look up to them will not feel that it's acceptable. Celebrities are one step removed from all of us. We see it as being heroic that they talk about the menopause, but they're not relying on anybody else. They'll still get the next part in the movie. In fact, they might get a better chance of getting the next part in the movie. People like Gwyneth, her entire brand is built around talking honestly about these things. But you never see a businesswoman standing up and talking about it because they know that they would be lesser if they spoke publicly about it. I would like to say to Lisa that I'm not a political person. I've never joined a political party in my whole life, but I am political. And I think today is fantastic, because if other political parties led the way in dealing with issues around women's health, we wouldn't have successive, awful tragedies in this country. I just did 2 documentaries on the Magdalene women who had to fight for redress, Ireland's dirty laundry. I was executive producer. It was my 3rd. I worked with Vicky Fáil and the people surrounding Vicky on the cervical check scandal. I'm always amazed that for a country who's treated women so appallingly in terms of women's health and women's health issues, that we've produced such amazing warrior women. And like, we have produced amazing women. Look at Vicky and what she's done. And she's effectively saved hundreds of women through her actions. A lot of the Magdalene women, by speaking out and talking honestly about their stories, have saved a lot of women. So for me, the menopause, Joe Duffy never invented the menopause. But, I mean, myself, Loretta Digman, who I'll bring up in spirit today, Catherine, and others, we've been talking about it for years, running webinars, global webinars. I work with Vital Voices, which was set up by Hillary Clinton and Madeleine Albright. So I'm on the European board and I'm a global ambassador. I work with women all over the world. We're no different. I work with a woman in Delhi who runs a huge company. She's going through the menopause at the moment. I would say that my mentorship is as much about the life stages these women, often going through difficult splits and divorces. It's much higher during the menopause. Now, you can read into that what you will. Either we all get a reality check during those years or run for the hills. But I mean, I do think that these issues for women are very significant. And as employees, Nurse Kate, I was talking to, I don't know if there's many nurses in the audience, but I met Nurse Kate earlier. Just before COVID, I was speaking about period poverty in Docas, which I do a lot of work with. Kate works in the prison side in Wheatfields. But you know, the issue about nursing, as much as I am complaining about not being able to talk about this in the boardroom, imagine you're going on to a shift in an ICU and there's a lot of people dependent upon you that day, especially with the shortages you see in the health service. We did a podcast series for nurses and midwives post-COVID about some of the traumatic events they'd witnessed, not just in ICU, but we did a whole one on the menopause, because these are women who are going through highly physical jobs on 12-hour shifts, not like me bleating about I can't go to the toilet and go through my hot flush. They have no capacity. They end up working on a ward where there's no one else to take over from them, and they're going through menopausal symptoms. So the INMO knows that this is a huge issue for them. So our employees won't get a better deal, I don't think, out of their employers until the CEOs themselves own up to the symptoms. So that was a long answer, but...
Thank you, Nora. Catherine, you, as I said earlier, you have worked with many companies, and at corporate level. So what Nora was speaking about there, do you think that is changing? And I have a second question that you might come to as well then afterwards. I read a column by the columnist Ciara Carey in The Independent sometime in the last year. And Ciara was saying that she objected to all of this talk about the menopause and how debilitating it can be for women and how difficult they can find it and how it can affect them, because she felt that reflects badly and poorly on women and their ability to carry out their job, and that it doesn't affect all women like that. So you might address that as well.
With brain fog, but we'll come,
no problem.
Come back
no
to
problem.
It. No, so from the first perspective, if you look at it, workplaces are stepping up.
Right.
And that's across the board, from retail to manufacturing to office, financial, etc. But we have a long way to go, and like Nora was explaining, different scenarios, with nurses and so forth. What about women involved in transport? If you have urinary issues, which we know are massive in menopause, where maybe you need to go to the toilet more often. If you're confined to a bus or a car or whatever, that becomes a nightmare. You can also say on the manufacturing side, if you've got a woman who's on the factory floor, if she's in a synthetic uniform, depending on the ingredients, hot flushes can just become an absolute cold dread because the ingredients in the uniform can make them worse. So when we look at it from the point of view of the workplace, we've got to look at it from the specifics of the role a woman is doing. You can't just take it as, you just one size fits all. If there's one thing we know in menopause is that it's not one size fits all. Every single woman will have a unique journey. So when you look at the workplace, you really have to look at each individual role. Someone in retail who's standing up, if they've aches and pains, that's an absolute nightmare if you're standing all day. It's going to be different for someone who's working in an office and maybe you can't control your air conditioning and you're having hot flushes, but you can't do anything about it. So, looking at it from the specifics of the role is really important. And a lot of companies are doing that. And I think...
And as speaking to Nora's point then, at how senior a level are you seeing women owning
yeah,
it?
I think that needs work. Right. Like ideally when I work with companies, I always kind of say, this has got to come top down. Right. We need to see it as a strategic, we need a compassionate conversation that's going to extend throughout a workplace. And ideally, we want to start seeing more senior managers, female senior managers coming out and talking about it.
But how do you do that without undermining yourself professionally?
I think that's where you start opening and supporting the conversation. Like there's some great companies. I mean, look at Anne O'Leary and Vodafone. Right. She's done a great job in embracing menopause, and not just in Ireland, across the world. But I think we need more of that. We need what Sheryl Sandberg did for pregnancy in companies. We need that for menopause. I always kind of say I'm going to be very excited when she hits menopause because I think she'll create a lot of changes. So it needs to come top down, but it also we don't want to put it all on women. We need men to come on board as well, because when it comes to menopause, it's everybody's business. It's not just the woman going through it, it's the family, it's the children, it's your friends, it's your work colleagues. We're all impacted. Like, I've got 3 boys and, we're always kind of saying, like you mentioned earlier, they're going through puberty. I'm on the opposite end with the reversing hormones. But like, when I have a bad day, we all do, when you get narky and you get cross with them, it's nice to be able to say, listen, I'm sorry, it's menopause, my hormones, and it's that upheaval. Ideally, I am really passionate that we get menopause onto the secondary school curriculum, on the SPHE classes, so that, like Shampa said earlier, it's increasing knowledge with girls and with boys, but especially with girls, so when they go to the doctor, they know what they're talking about. Like the amount of women who I'll talk to about menopause symptoms and they're like, oh, I didn't know that was menopause. And it's like understanding your bodies and actually knowing, what are the symptoms of vaginal dryness? What are the symptoms of urinary incontinence? What are the emotional symptoms of menopause that I need to be aware of? Because what happens with a lot of women, particularly in perimenopause and particularly in work, they will suffer brain fog. And that's why I said you'll have to repeat the second part of the question. But they will experience brain fog, and what happens is it impacts your confidence and your self-esteem starts to be hit and it starts to fall. It's a real ripple.
So you partially addressed the second, but I'm wondering, how do women go about doing that even collectively without giving fodder to that argument of you can't rely on women, look, if that's what's going to happen, why do women want to reach for the stars in terms of their career if this is going to be their middle years and what it's going to be about? I
firmly believe women are, we know in the 45 age group plus, fastest growing demographic in the workforce. Women, we want careers, we enjoy our careers, we love what we're doing. And we need to be supported in doing that. One of the things is that we can support each other collectively, but then we also need that support to come, not just from the workplace, we need it to come from society, from the government. It needs to be a 360 support, because menopause, particularly the early perimenopause years, when you don't know what's happening, can be really lonely and really isolating. And this is where we need that education piece to come, you know, that national awareness campaign, so that we know what to look out for. And then I think part of that is feeling supported enough that you can open it up in the workplace and actually say to your manager, whether they're male or female, younger, older, which is very common, listen, I'm struggling with one or two challenges of menopause, you know, I need help here. And all employers will want to help, the majority will. And it's just a matter of, I think, supporting menopause doesn't have to be expensive. It's just thinking outside of the box and thinking practically. But you know, it needs to be, and it's not just the workplace, it's women across all of society, minority groups. We need to make sure that education extends. Like, as I mentioned to you, I've done a lot of work working with the unsettled community, working with women with intellectual disability and so forth. And that's a whole area of society that we can't forget, because the conversations and the treatment options can be more challenging. And I think the key part really is that for a woman to thrive through menopause, because we all want to thrive through these years, we don't want 38 years or continuing of pain. The key there is knowledge and awareness, because with that education, you know, okay, here's who I can go to, here's how I can get help, here are my treatment options, and then on the back of that, you bring your support into play, and obviously your lifestyle, and you bring it all together. But education it's the cornerstone, it's the foundation for women to thrive through menopause.
Thank you, Catherine. Ciara, can I ask you, obviously there's been a lot of improvement even in areas like women going for smear tests, for instance, but I'm always very surprised when you hear on discussions like Liveline or elsewhere the number of women who say they had no idea that there was even such a thing as the perimenopause. So, and I'm just wondering, Catherine mentioned there, we'll say running an information campaign, but I'm just wondering how Irish women, how ill or well informed, where we sort of stand on those. You mentioned earlier the difficulty in raising issues such as the urinary tract infections and that, but it seems like it's a much wider, even on the broader picture, it's an issue.
And I think we have to, like you say, start in school. I think there's ground to be gained in terms of education about the menstrual cycle. About the different phases of the menstrual cycle. When are you fertile? When are you less fertile? What's normal? What's not normal? Because I suppose we're so used to accepting our lot, accepting what you've dealt, that I suppose, like Fayqa said, that, people become anemic from heavy periods, but they think they're tired because they've got 3 children, or they think they're going through menopause. It's understanding that those symptoms are not just to be borne and put up with, that there is, that they need to be investigated and that there's help there. So I think we do need to start from kind of a grassroots, ground up, sexual reproductive health care and education. I think it needs to be expanded on in school education.
And Shampa, you have the added experience of having had cancer and then going into menopause and sort of trying to get help there, and I think not very satisfactorily.
I mean, I think when you move into perimenopause and menopause, it's like you're a milk carton and you have your use-by date stamped on your forehead, and it's like you're put out of commission. And I still have a lot of my life to live. I'm not ready to give up and disappear into a back room somewhere and have a hot flush. And we talk about women having careers and enjoying their careers. I think that conversation really needs to change from women enjoying their careers to women being good at their careers. I'm the general counsel of one of the richest companies in the world, and I'm now going through menopause. And my company will have to replace me. And the cost of replacing me versus just allowing me to experience my truth, and whether I'm having a hot flush or a brain fog or whatever it may be, I am valuable to my company. And we as women need to stop being on the back foot all the time about our experience. We need to start putting ourselves forward and saying, I am valuable to you as a company. I have skills and knowledge and a history of this company that nobody else can replicate. So I'm now 50, I'm going through a life change. You need to support me through this. And we talk about the tone from the top. I'm in a company where all the men on the board, all the board members are men. So the tone from the top, I hear this all the time, the tone needs to come from us, wherever we are within a company, whether we are on the board, middle management, on the floor, driving a car, whatever we're doing, a nurse on the floor, we need to be more vocal and we need to have opportunities to talk about our experience in a compassionate and understanding environment. So I have to say kudos to Lisa. I'm with you, Nora. I'm not a particularly political person. I'm not a member of any political party. But these are conversations which we need to start having in an open and compassionate way. And we need to start valuing ourselves more than what is currently, which is more than what I currently see going on.
I love that fighting talk. I think more of it. I'm going to go to questions now, but I just wanted to ask Fayqa, because I suppose context is important as well. So do you think Irish women are lucky? Is their situation good where?
Compared to our country, they are lucky.
Yes.
They have opportunity to go to the doctor. They have opportunity to learn about themselves, about their signs and symptoms of their menopause or other things. Most of them are educated people. They can learn, they can read from websites and other things.
Yeah.
But in our country, unfortunately, most of our women are illiterate people, uneducated people. Most of them can't read, at least in the rural area. And also they don't have too much ability to go through the website or to media to learn something. Just the best thing was that trained midwife from very rural area, from villages, that we brought the young girls or women and trained them and send them back to the villages to work as a family health action groups, or some of them work through the community and pass the health education messages to the people, and they give health education to the people how to they should take care of themselves and how they should know about the early stage of their menopause symptoms, and if they have some problem, they should go to the doctors. At least they can take some iron tablets or calcium or vitamin D and other things that they can improve their body. But unfortunately, all this thing is stopped, and it is.
That certainly does give us very good context. Thank you. So any questions? And if you want to generally, or you may want to put it to a particular member of the panel. Just down here, I see a hand raised, grey jumper behind, and then the in the purple dress, the next. Then in front.
Thank you. I would like to know what would be the best steps to raise awareness in greater audience, because if it's not awareness about menopause, a woman would be shy to talk about it. We need to raise more awareness. So what would be the best steps to start?
Okay, and do you want to ask anybody in particular that? You're saying, so women that are shy about talking about the menopause.
And what would be the best steps to overcome this shyness?
And do you mean do you mean talking to, we'll say, a doctor, or in a workplace situation?
In workplace,
Workplace, okay. And is there anyone you want to ask, or will I?
You can.
Okay, Catherine, I'll put that to you. Thanks. And then just the purpose.
Alison, will I take a couple of questions together, or do you want to do
Actually, that's not it. Yeah, that's probably
just
a
to
good
make sure
idea.
we get a few
Just
people
in
in.
front there in the purple, and then behind you, Lisa, and the other side in pink. Yeah.
Thank you very much. I just want to take the opportunity as well to thank Lisa for this. I am a member of Fianna Fáil, I'm a councillor, and I just want to commend this. It's not just this conference, it's been for a number of months now, on a weekly basis, bringing in stakeholders to the female members to have a worthwhile policy document at the end of this. So I just want to commend Lisa for the work on that. That whole process actually has kind of, I suppose, opened my eyes a bit more to it as well, and myself and Alison was speaking a while ago with regards to the brain fog, and it's leading me back to the education side of things that you were mentioning, Catherine, because I would class myself as being well educated and relatively confident, and I would have to say straight out to having known nothing in relation to menopause other than sitcom references to hot flushes.
They call it flashes in the States, which is probably why you're
that's
saying
exactly
that, American sitcom.
So, in the sense that until you're suddenly going around and doing something in your day and just saying, "Jeez, I'm roasting," and you're moving on, and you might mention it in front of somebody, or the meetings and conferences and sessions that we had, that you're kind of going, "Oh, geez, yeah, I'm not 20 anymore either." Yeah, so maybe there's something else going on here. So it's leading into something that I think that you were possibly referencing to a moment ago, Alison, with regards to, we have so many screenings and different things for the good or the bad, and that has happened with them in the past. What is always commendable about those systems is that you get your letter in at a certain age for where you are in that system and what happens next. And I wonder, with the talks of the menopause hubs and that, I know GPs are absolutely slammed, very, very aware of that. But should we be looking at something, because I think certainly schools, but those of us are now past the school side of things.
Wider,
we need to be, I think, more mainstreaming, and I actually looked up the HSE website, and it's, contact your GP if you're having trouble with your menopause symptoms, but most of us don't even really know what our menopause symptoms are, and I know it's wide and varied. So I just wonder, would Ciara or any of the panel think?
Point. Yeah.
I just have one lady that has a question on endometriosis, so I might bring her.
Sure.
Yep.
Sure.
Hi, my name is Hannah. I was actually just recently diagnosed with endometriosis, so luckily enough, I'm only 22, so that was a very short period. I mean, 3 years, I say, is short, but I'm glad to have had such a short in comparison to most people. But I mean, only through my own research is how I found out about this thing even existing. So I never heard about it in school. I was wondering, if there are any plans, what are your plans for teaching young women about this in school through SPHE? I mean, I learned about my cycle, but I actually learned more in my science class in junior cert than my SPHE class. And then I recently saw, even in the UK, there are young girls learning more through TikTok about their menstrual cycle rather than through their schools. And I think I'd say the same here as well. I'm learning more online than I am through, that I ever learned through school. So I guess, what are your plans in place?
I think that picks up on the really important point made by some of the panellists about the need literally at secondary school level, and I suppose on the work that Lisa is heading up in terms of getting a policy. Yeah, I think the woman behind you there in the pink, yeah.
Good morning, Alison. Good morning, panel, and thank you, Senator Chambers, for leading out on this wonderful policy and the conference today. My question is around brain fog, and we say a client has become addicted now to antidepressants to treat brain fog and is looking for help, seeking help to get off the addiction, and is wondering, how can she safely come off the antidepressants without the fear of going back into brain fog? So if the panel might have an answer to that. Thank you.
Okay. Lisa, do you want to just over at the edge here, I think there was, maybe if we take two more. There's one there, is there? Yeah, okay.
Fayqa White, I'm the Women's Health Officer at the National Women's Council. Something I feel like I've really heard come across from all the experiences is that women's experiences of health are not taken seriously when they go to their GP in the workplace. and that they're not given that, they often feel dismissed and belittled, and that's something that we really hear in our work in the National Women's Council. And I suppose my question is for Ciara, what is being done to make sure that kind of medical practitioners, GPs, are listening to women, and what more could be done to ensure that there is that culture of care, that women are taken seriously?
Okay.
Thank you.
Thank you. Go over at the... So there's two there and one here at the front, and then I think we'll...
Nike Ogunsoke. It's not really a question, but I just want to contribute that this issue of menstrual and menopause should be taken beyond here, because many might not be able to discuss it at workplace, but it starts from the home. So that just like the sister there, Shampa, said that we are valuable. So the value has to start from home, so that all our boys, men, will be aware, so that when we go to workplace, it will not sound new or somehow to them. Let them know what we are going through, and the younger ones, let them know that it has to happen. And when it happens, let's support one another. Thank you.
Here. Yeah. Just there, yeah.
Thank you. My question is for Dr. Fayqa. I wonder if you could speak about the particular specific challenges that women in migrant populations or refugee populations living in Ireland might face in accessing care in terms of women's health.
Okay. Yeah. Okay, and one more here.
Thank you. Thank you very much for your contributions. Just brilliant to be in a room of women talking so openly. I don't have a question, it's more of an observation. Just when we're getting to the point of talking about women's health and not being embarrassed about it, I feel like we're losing the word woman. And I know that Cervical Check removed the word woman from the website a couple of years ago, and because of Joe Duffy, the saint, and a woman who rang in, the word woman was put back into Cervical Check's website. The word man wasn't taken out of the prostate cancer screening website. And so I think we're here at a women's health conference. We're not here at a uterus havers health conference or cervix havers health conference. And when we're talking about language, we need plain language, but we also need language that we recognise refers to us. So when we're talking about women's health care, we need the word woman.
Okay, thank you. Now, I'm conscious of time and of not encroaching on the next panel, so I'll put some of those questions, and if you wouldn't mind keeping it brief. Catherine, I might just put you the first. If you're feeling shy, how do you broach the conversation?
Two things I would do. If you have an option to use email, I would send an email to your manager, boss, whoever, and I would just write it on an email, like if it's menopause related symptoms or even if it's menstrual pain and so forth. I would just write down, I'd like to chat with you next week, give a bit of time, about some menopause symptoms I'm having or some menstrual symptoms I'm having. What that does is it gives the manager, the boss, time to make sure they can do a bit of education awareness on their side. It also gives you time to prep. If you don't have access to email, I would still just over coffee maybe, or just grab someone at work, or whether it's the manager or HR, and just say, look, can I talk to you in a few days' time? That's the real trick, is just giving awareness and notice, because then it'll be a collaborative, supportive conversation.
Thank you, Catherine. Ciara, that issue of women feeling, and that's a lot of stuff that did come up in those live line discussions, women saying, doctors either saying you're not bad enough, or I'm not giving it to you, or, is there enough education amongst doctors, the medical community?
So I think that, like I said earlier, I suppose for 20 years, HRT was something that most doctors were told you shouldn't prescribe. Yeah. And we have to, that culture doesn't change overnight, but I think how we change it is through education. Yeah. And the ICGP are working, I suppose, in conjunction with the National Women and Infants Programme on the kind of key priority areas that have been identified in the Women's Health Plan. And we would hope that by increasing education in the area of menopause, endometriosis, and I suppose specifically contraception are kind of 3 areas that are being worked on currently. That I suppose GPs being more comfortable and more knowledgeable in those areas with the kind of most up-to-date evidence that they will be able to better address women's concerns.
Shampa, I'm going to ask you and then come to Fayqa, that because I know that you, as a patient advocate in terms of migrant women trying to access health service, and I'm sorry to say to keep, if you wouldn't mind keeping it brief.
I mean, in terms of ethnic minorities and racism in modern society, I think there is a danger when you generalise that you lose the power of the individual story. So I'm going to speak from my own personal experience, but I'm talking about those members of society who are at the lower socio-economic scale of society. They tend not to have private health insurance. They're diagnosed with a chronic illness and they'll go into hospital for treatment. A very specific example of structural inequality in the provision of healthcare in Ireland is the fact that you have this accumulation of inpatient charges for chronic healthcare. So if you're at the lower socio-economic scale of society, you tend not to be able to afford private health insurance, whatever the premium may be. Let's just say for argument's sake it's €1,000. Every time I went in for chemo, for 18 months, every 3 weeks, I had to pay an inpatient charge. It was capped at €800 a month, €800 a year. So if you are at the lower socio-economic scale of society, you are not going to have €800 floating around to be able to pay for this accumulation of inpatient charges. Where we see structural inequality is the unintended consequences of good public policy, where people who have these hurdles just happen to have the higher hurdles that I mentioned earlier. We live in what I consider Ireland to be as a benevolent society, and these structural inequalities, we're all aware of them, but they need to change.
It's high indeed. That's, and it's obviously something we could talk about for a long. Fayqa, do you, for women like yourself or for migrant women, is it difficult with the Irish health service if you need to go to the doctor, go to hospital?
Yeah. I was in refugee center in Roscommon.
Yeah.
There was 2 women that they had heavy bleeding and long period.
Heavy bleeding,
Heavy yeah. They went to the GP, just the GP gives them some contraceptive pills, but they didn't do any more treatment or diagnosis.
Okay.
They need more diagnosis, tests and proper treatment.
Okay. All right.
And also the refugees people, they should know about their sign and symptom, and they should have more education, like health education, having some messages about their health.
Thank you. Nora, I'm going to ask you to give us a rally and cry before we leave. All this knowledge
I'll tell you
on the stage.
I had the most productive years of my life going through the menopause. I achieved far more than I've achieved at any other moment in my life. I mentioned the consequences of menopause, you know, when you're trying to be superwoman, and we all try to be that. Going back to the issue of inequalities, I was very privileged. And this is an issue where privilege is really important. For one thing, I know to research everything about my own health. As Vicky Phelan says, when she took control of her health, that's when things began to change for her. She's 4 years beyond a 1-year diagnosis. And I took control by learning everything I could possibly know about the menopause, finding myself a brilliant gynecologist. I couldn't afford to have those symptoms, that's the reality, so I didn't. I had brilliant HRT, I was managed throughout the whole process, I didn't have a single symptom after she took control of my life with me. Loads of women aren't in that category. There are loads of inequalities when it comes to the menopause. It's very, very hard to access consulting care without forking out €300. There's a massive shortage of HRT. And I'll tell you one thing that's happened in the absence of that. A whole bunch of charlatans have emerged since Joe Duffy. I mean, I am inundated with chefs who now produce menopause menus, wellness clinics that have it's like when organic
Nora,
came out.
I hate to cut you off, but I'm very conscious of the next panel. I would like to thank my panelists very much, and thank you all for listening so well. Thanks very much.